Hey, Dave.
And again, this is another part of our series in, how do we stay healthy and how are we able to care for these guys during this current crisis? What are the things that we can do as organizations to keep them safe? During today's webcast, we're going to do a brief update on the COVID-19 crisis and go over some things and information as we know it right now. And then again, we'll be joined by Dr. Elizabeth Berliner, who will give us additional information and can answer some of your questions and answers. Couple disclaimers right up front here. We are sharing what we believe to be best practices. Information's changing. Some of the stuff that we shared with you 3 weeks ago is different today. And every time there's a new press conference, every time there's a new order that comes down, things do change a little bit. So we certainly encourage you to consult with your own local legal experts and authorities. If you're going to make any severe policy changes, you want to know about deadlines, filing deadlines. Today's tax day and we didn't have to pay our taxes today. We've got till July 15th, but always make sure that you're getting the most accurate information and consulting your local legal folks to give you those answers. We don't have all the answers. We'll tell you that right up front, but we probably know somebody that does. So feel free, like I said earlier, there's a question and answer box down at the bottom of your page. There's a chat box at the bottom of your page. Please give us all the questions you can. We'll do our best to answer them, but if we can't get those answered today, we will get back to you after the program and make sure that we've got everything to you. There will be a recording of this webinar available shortly on our e-learning system. It'll also be up at mcneillandcompany.com. There's a link there for webinars. We'll tell you what's coming up in the future, and it'll give you some information on how to view the webinar as we're doing it today. If you've got any questions after the program, anything that we didn't cover, feel free to email us there at riskmanagement@mcneillandcompany.com. You can also call our phone line, 1-800-822-3747, extension 176. So again, sit back, relax. It looks like we've got Lee back up with us at this point. So I'm going to turn things over at this point to Lee and Jess. Go ahead, guys.
Okay, thanks a lot. And Jess, you go ahead and introduce yourself.
Hi, I'm Jessica Milkey. I am the Risk Management Safety Specialist for the Animal Keepers Program at McNeil & Company. And these guys down here are all my fur family, Wagner, Peach, Hero, and Harley. So thanks everyone for coming today, and look forward to a good webinar.
Thanks, Jess. I'm Lee Price. By the way, Dave, thanks for jumping in there at the beginning. Hopefully the internet problems are behind us. I'm a risk management training specialist here at McNeil & Company. Also EMS training director at Tompkins Court and Community College. Have a strong background in public health and have been watching this COVID thing pretty closely for, well, way too long. And it looks like we're going to be watching it for a little while longer. But there's my entourage, our 5 furries that live in the house, plus we have a few horses that thankfully don't live in the house, otherwise vacuuming would be no fun at all. So let's jump right forward here. First thing we want to do is give you a little bit of an update as to where we stand today with respect to the COVID crisis or the pandemic situation. So looking at it from a United States perspective, we have those numbers are staggering, really, but there is a little bit of hope, a little bit of light at the end of the tunnel. If you're looking at that graph, that yellow graph line is the active cases in America as of about 6:30 this morning. And on that graph that we had up there, I don't know if we can get back to it, Dave. On that graph, we were starting to see a little bit of a right turn, which means that we're starting to see a slight slowdown in the increase in those active cases, and people are recovering. So hopefully that means better days are ahead of us, and we can keep our fingers crossed in that respect. One of the reasons that the numbers seem to be going up and have been rising, it seems like they've been rising rapidly, is we're testing more people than we ever have, which is good. The downside is we're finding out more people than we ever expected are positive with this virus. A lot of people who don't even look sick, don't even think they're sick, and that's why we're having so many problems trying to control this thing and try to contain it. We know that some areas in the United States have been very horribly, terribly affected. Some cities in particular, seems that where lots of people happen to be is where there's lots of community spread, which kind of makes sense. But unfortunately, we're seeing it in what is quickly becoming every county in America is starting to see cases, and severe and critical cases on top of that. Right now, the projections, as I mentioned, we may be at the worst based on some of the projections that are out there. To these days, this week is projected to be about the worst for the United States, provided everybody continue to abide by some of these community controls and social behaviors. And the prediction is that slowly it's going to decline, but it's going to kind of roll through the country a little bit in the meantime. For instance, we're in New York State. We know that the tri-state area of New York City and New Jersey and Connecticut have all had a very, very bad time with it. And now we're starting to see a little bit of an increase or uptick in the incidence and of people becoming sick with COVID-19 further up in some of the more rural counties. So it's going to roll a little bit. So we need to continue to be good about all of the things that we've been trying to be good about. And one other just note that more than, right around 90% of the United States population right now, that's all 50 states, are under some kind of stay at home or pause or movement restrictions to try to contain the community spread of this virus. So some of the things that have changed are things that we changed that we know now. Right. Well, one thing that hasn't changed that we're really, really sure of is the social distancing policies and the practices, keeping everything clean, keeping ourselves clean, washing our hands, covering our coughs, staying 6 feet away from each other are all things that are really, really effective and in many ways our only defense against this virus. One of the things that was sort of a hot topic in the news over the past few weeks is the CDC has been taking for a very long time a hard look at whether or not healthy people should be wearing masks. And the recommendation did very recently change to suggest that now healthy people, not my friend there who's speaking through his mask, which is, I think, a really cool picture, but I bet it probably stayed on for about 3 seconds knowing all of my critters. But people should be wearing masks anytime they can avoid a situation where they can't maintain their social distance, they're 6 feet or more, they should be wearing a cloth mask. And the point behind that and the logic behind that isn't so much that it's going to protect you from getting sick so much as it's going to, because we don't know who is positive with the virus, we're protecting everyone around us from getting sick. And that's really, most health professionals are agreeing that that's the predominant advantage of wearing those masks. But there is some limited protections for people who, from being contaminated while they wear one of those cloth masks. And when we're talking about cloth masks, it's pretty much any face covering, anything up from a bandana to a surgical type mask. Hopefully you're not burning through N95 respirators for just walking around in public. Two other little things. The CDC has new guidance for what they consider high-risk people. The high-risk people are, they've added a couple of concerns as far as people who are smokers and vapors and who have a history of working in areas where there's a lot of airborne contamination. And they've also changed some of the guidelines for essential workers and when they should work and where they should work. And depending on where you are, go to the CDC website and they will stipulate a little bit clearer as to what the guidelines are. But they even say essential workers who've been exposed, if they're essential workers, provided they meet wearing their mask and other guidelines, then they can continue to work. So that being said, that's kind of your roundup on where we stand right now with respect to the pandemic. Jess, would you like to introduce our guest?
Yes, I'm very happy to introduce our guest panelist today, Dr. Elizabeth Berliner, ED. Thank you very much for coming with us or being with us today to do this webinar and helping answer questions for those out there that are really seeking what guidance out there for their own shelters. We've already had a question come in from HSJC. It says in their state, modeling shows we pass our peak infection. They've passed their peak infection a few days ago. And what data are we looking at accessing in terms of deciding when to roll back guidance restrictions such as spay, neuter, and intake? Evie, unfortunately, we can't hear you. Not sure what happened. Huh.
Yeah, you are unmuted at this point.
I don't know. Sorry, folks, we're experiencing just a slight technical difficulty.
Lee, while we're trying to get her sound back, maybe you could answer some of that question. And, you know, people are confused and concerned right now about the peak date and what that means and what it means. Everybody's obviously concerned about getting back to normal. What are some of the precautions that we've got to take to make sure that we can get back to normal, and what's that look like?
Yeah, I can tackle it from a sort of a broader, more social standpoint. When there's been a lot of talk about these projection models in the news, and we see them on a lot of briefings and things, and there's a couple of them out there that the researchers are looking at, and so far the ones I've been watching have been pretty spot on. And you're absolutely right with your question that some states and some areas are at or just past what is considered to be the projected peak of the disease. So that's wonderful. That unfortunately still means we're at the top of this hill, and a lot of the projections are showing a much more gradual decline on the other side of the hill. So while everybody is, you know, I'm along with most people. I think it's ready to go outside. It's ready to start doing life like we're used to again, and going to work like we used to again. But the truth of the matter is, we have to wait this out, and we have to be sure that we have a real control of what's happening and what the problems are before we really seriously consider what we would consider a return to our old normal as opposed to what is currently our new normal. So I think having this conversation, it's important to start this conversation, and I think you know, getting this input and guidance is absolutely the right thing to do now. But my prediction, based on what I see for life in general, is that it's going to be several weeks or more before it's considered safe to really go back to business as usual. EB, have we been able to get your microphone back? Unfortunately not.
We are working.
Trying to get her phone number off the invitation. If we can get her phone number off the invitation, she can call in that way.
She's working on that right now.
Okay.
So we apologize for the brief delay. We are getting that work done.
EB, if you can give a call in 410-456-6430. We can promote you up so we can hear you that way. 410-456-6430.
Huh.
We apologize again for the technical issues and things. And in the meantime, I think it's important, you know, while we talk about the projections and while we discuss that return to normalcy, it's important that we keep focused on the fact that what is going to make those projections work is for us to do all the right things, you know. And I blew through it kind of quickly again earlier in the when I was doing my review, But it's the social distancing, as I mentioned, is the only thing that defeats this that we know of. We're still working on the medications to treat it. Nothing right now is showing to be effective at killing or destroying the virus. We
Right.
are only providing supportive care to the people who are sick. In other words, trying to manage their illness as they try to recover. And we are also have vaccines. So the social distancing and maintaining that is what's going to make those projections come true. Part of the modeling there, it's very, very complicated modeling. Hats off to those mathematicians. They're beyond genius in my book, where they're essentially trying to predict the weather with and their accuracy is as really, really ridiculous. It's really great how much they've been spot on as they go along and how they do this. So the important thing is, for those projections to come true, we have to not start doing things, even though it feels like things are getting better. It's getting warmer out. The sun's up a lot longer. We want to go out. We want to go back to work. We want to do all these things, but it's really important that we be very careful before we do that to make sure that we have actually contained this. The lessons, well, South Korea, for example, has been doing all the right things, and China has been doing all the right things. They finally have started to slowly lift their restrictions because they've been able to demonstrate to themselves, and I think to the rest of the world, that they have a pretty good hold on it, they think. Unfortunately, Hong Kong and Japan are two examples where they opened up the doors and started doing normal things too soon. And Japan, it took a lot of hard work for Hong Kong to recover. Unfortunately, Japan is declared their second state of emergency after thinking they didn't need it anymore for a while after the first.
Exactly, and that's why we need to keep social distancing. A lot of shelters right now, they're working on keeping social distancing while still being able to take care of the animals.
Can you guys hear me yet?
Yes, we can.
Oh, they got audio. Okay. Okay, can you still hear me?
Yes.
Okay,
yes,
excellent. Sorry, I didn't mean to interrupt. We were trying to figure it out.
No, that's fine. Just working on talking about how we're doing shelters are doing social distancing by doing that team A, team B, only being on certain days and certain people and still maintaining that 6 foot distance. So this way, there's not a lot of contact, and disinfecting all areas of common places to make sure that they're not spreading any kind of virus should they be asymptomatic.
Great. And the question that the person typed in is one that I've gotten a lot in the last couple of days for the very same reason. Like, we're watching these models, we're feeling like, okay, we've hit a peak, maybe we're on a downward slope. But if you look at a lot of those models, and Lee referred to this, if you look at the ones that are kind of projecting forward, they're really talking about up to 3 months of stay-at-home restrictions, right? And in some cases, they break that out, whether it's strict or lax. And so what does that mean for shelters? And what does that mean for spay-neuter clinics? And what does that mean for vaccination clinics, which is another big question I've been getting. And I think it means that we need to be, just like our states and our government are trying to be strategic in terms of how they send people back to work and not just kind of opening the gates, we need to do the same thing in shelters. And so the kind of data that we're talking about looking at, since that was the question, it's not specifically like modeling data necessarily, but it's about looking at what are our most essential services and what are our priorities, and how do we pick and choose the pieces of what we're doing in a way that still minimizes human contact. And so, for instance, opening the door to a large-scale vaccination clinic in an urban center would bring hundreds of people together to stand in line. And that is something we commonly do in shelters in normal times. It is not something that we can do now. And so one of the groups I was working with this morning, we were talking about how do we prioritize particular animals and populations. For instance, puppies and kittens, because they're the ones who most need their vaccines to be protected from parvovirus and panleukopenia. How do we prioritize overdue or absent rabies vaccinations? Because those are highly essential. And so figuring out a way to really market to the high priority animals, and figure out a way to then manage the people so that we can still maintain social distancing. So this is nothing that a shelter is doing tomorrow, but they're starting to try and think about what do we do in a few weeks from now to start tackling those high priority items. Another is spay neuter, and certainly I'm the first one who wants to get back to doing spay neuter. I'm a high volume spay neuter surgeon. I've done spayathon in Puerto Rico where we do hundreds of animals a day. Like, high volume spay neuter is my jam. But it is not the kind of thing that we can throw the gates open on. And so as we start to talk about what happens next with spay neuter, there's really kind of three elements to it. One is, how do we keep our staff safe? Because if we start exposing them to more people and we start exposing them to each other in closer contact, we increase their risk that they will still get sick. This isn't over. Two, how do we minimize our use of equipment in terms of PPE and anesthetic drugs? Anesthetic drugs for spay neuter, the very same drugs we use for spay neuter, are the ones they use to sedate patients on ventilators in the human market. And so there's a shortage of medications, controlled substances, at this point in human hospitals in the hardest hit areas. And a lot of the veterinary clinics have those medications in stock or need those medications to do spay neuter. And so just yesterday, the DEA, the Drug Enforcement Agency, sent out a notice, and I got it in my box as a veterinarian who has anesthetic drugs, that there's a chance I may need to transfer some of those to the human health field. And so keeping that in mind, that says to me, I really can't ramp up for spay neuter, even if I was done with worrying about it in my area. Like, there's still a need for those supplies. And so I really have to, again, think about priority patients, those with emergent needs for surgery, those with infections that require immediate surgery, potentially some of the ones that may be in situations that make them high priority patients. And then the third part of that is that we are absolutely going to have a backlog. And so what are some things that we can do to manage that? And some of it is, this shouldn't be a backlog to adoption. We should be adopting with spay neuter vouchers, and we can catch up on them later for animals that are in safe homes and not in breeding pairs. Some of it is making sure that when we do start to do spay neuter, we kind of tap those high priority patients first and get them into the clinic first. And then there's even some talk now, Jess, I don't know if you guys have been in on this, but there's some talk about, for community cats, feral cat populations and that sort of thing, reaching back to a few years ago and using some birth control for them. And so there is available birth control for cats. It's not good to use for the long term, over 30 weeks. But we can get essentially 6 good months out of some birth control for cats to prevent estrus and pregnancy. And we do it at very, very low doses, and it can be fed to a cat once a week in food. And so we're now looking at that as a possibility for some of our really high risk, potentially outdoor cat populations or that sort of thing, as a way to manage this. And so after a very long answer, my short answer is we're not ready to throw open the doors on spay neuter yet, but we're certainly ready to start strategizing about how we manage moving forward, and thinking about what are our priorities and how do we do this.
No, that's great. Is that going to be for, just not just, someone that comes in and says, hey, I've got a, potential, I don't have my animals, spayed, can I get pregnancy? Or is that going to be for those that are actually stray animals that, they care for them with, throughout the community, and could they come in and talk to you about that as well? Or is that a possibility?
So we're talking about it for both sorts of populations. Truthfully, for female cats living in a home, 1 or 2 cats, there's no male cats in the house. I don't know that I'd reach for it. A lot of people can kind of stretch that out, and if the cat goes into heat, they deal with it. But if there's no males around, it's less of an issue, right? If they're an indoor cat. I think this is more directed at kind of large outdoor colony cat situations. It does require a veterinarian to be engaged in the process. It is a prescription drug. It can be ordered through compounding pharmacies. And depending on the state that you are living in, the veterinarian may or may not be able to do that by talking to you and essentially doing telehealth over the phone. So it needs to fall under the guidelines of the veterinary client-patient relationship and telemedicine restrictions in your state.
That's perfect.
A lot of states have relaxed their veterinary client-patient relationship during this time, meaning that a veterinarian can talk to an owner, do a telehealth visit over a Zoom meeting like this, get a sense of what's going on with the animal, and then have a prescription sent to the home. So that's not possible everywhere, but it's possible in more states now than it was prior to this. There's a huge move on the part of the AVMA and the FDA to try and increase access to care in that way.
Perfect. Thank you. Just coming back to some of the things that I was talking about earlier, about taking the precautions to avoid exposure within the shelter. I know I briefly mentioned about the Team A and TB. Can you elaborate a little bit more on that?
So last week we talked, or 2 weeks ago, we talked about kind of making sure you separate your staff into 2 separate teams that don't overlap. Certainly a lot of veterinarians and veterinary staff were already wearing masks in practice because it requires us to get pretty darn close to each other if we are restraining an animal and doing medical procedures on that animal. Now it is required in New York State that essential workers are wearing masks if they're in close contact with one another, which essentially that is a lot of shelter medicine practice. And so that is certainly playing a role. I think the bigger thing is just remembering the fomite transmission is a huge one. So doorknobs, keyboards, that sort of thing, I think is really important for this virus. And I would continue that with an emphasis on the fact that our biggest risk is still other humans. There's no indication, and there have been several cases in the news and that sort of thing that we might have questions about, but there's no indication that companion animals or animals of any type serve in the transmission of this virus to people. And so the animals are not a risk to us, but we are a risk to each other. And in some cases, we may be a risk if we are sick to cats. So I don't know if you've had any questions around that, but there have been a couple cat cases in the news that are interesting. But the big take home on that is our biggest risk if we are essential workers and going to work is other workers in shelters, not the animals. Even animals from COVID positive homes are not a risk to us.
Well, I know we talked about domestic animals not being COVID positive. What about the Bronx Zoo, the tiger being tested for COVID?
Yeah, so I think since then we've had a couple of new cat cases, the tiger being one. And so again, important to recognize that that tiger was not involved in passing the disease to anyone. However, there was a tiger at the Bronx Zoo that developed respiratory signs, and amidst testing for many things, which required sedation, obviously, and a collection of samples, they did test for COVID, and that tiger did come up positive for COVID. They're still unclear on exactly how the tiger got the illness. They assume that it is a zookeeper or animal care attendant of some one of them that must have somehow exposed that tiger. There is some surprisingly close contact reported. So we wouldn't normally think of a tiger curling up with people and that sort of thing, but there is actually some target touching and things through screens that they do. Last I knew, and this was as of yesterday, there was no confirmation on any human that tested positive at the zoo. So it's not as though they nailed down who was involved in this transmission. And last I knew, the tiger seems to be recovering just fine. There were some concerns that there were other big cats at the zoo that were also showing respiratory signs, but none of them have been tested because it requires anesthesia, and none of them have signs significant enough to warrant that. A couple of other things that have come up with cats since we talked last time. So I think we had talked about the initial cat in Belgium who did become infected with COVID from a sick owner. And then there was a laboratory experiment of cats where researchers gave cats very high doses of the virus. And then the younger ones tended to become sick. And this was a small number of cats. I want to say it was 5 or 6. The younger ones seemed to become more sick with it, and they did seem to spread it from cat to cat, although the study design on that wasn't totally clear on whether there could have been some fomite transmission as well. And so that suggested that we did have some concerns about cats that could become ill with the virus if exposed to high levels by a sick owner. There have not been additional cases reported, which is great news, especially given how many positive human cases we've had. We keep saying in shelter medicine that we would expect at this point to have a higher rate of symptomatic cats from COVID positive homes if that was the case. There have been a few scattered tests of cats belonging to COVID positive owners, and they have come up negative in those cases. And so although there is a risk to cats that we can give it to them if we are sick, it doesn't seem to be common at all based on the few cases that are out there. If I can add to that, testing is now available in a lot of states, but it is not recommended to test companion animals, partially because it takes supplies, partially because it puts people in close contact with one another in order to do that testing, and partially because we don't really know what a positive test means in terms of how to interpret it and how we should then handle that animal going forward. And so the emphasis is absolutely not on testing animals at this point, especially as people are still struggling to be tested. But we do have some concerns that if you as a pet owner are ill, you should treat your cat just like any other family member, which means maintain some distance, wash your hands a lot, potentially see if someone else can feed that pet if you have multiple caretakers in the home. So cats, if nothing else, this has proven that cats are family members and we need to handle them that way. Ferrets are also at risk, so they have the same receptor that cats do for this virus, and so ferrets are more risk. Dogs seem to be a lot less important in the scenario. Initially, there were a couple dog reports, but not much has followed since then, and we seem to not think that dogs play a role in this at all. There was a quick story that came out late last night. I want to mention it. One paper that came out with a molecular genetic-based paper. It's very weighty, it's very heavy, and essentially it was reviewed overnight, and people are not thrilled with the science. And so we've essentially kind of debunked that paper. And although it created initial stir that dogs might play a role in this, scientists do not believe that to be the case.
We've got another question comes in along those same lines. Are there any new experimental treatments for FIP in cats and any hope for a cure? Yeah,
great question. So I just finished a textbook chapter on FIP 3 days ago. And so the most interesting tie between FIP, which is a feline coronavirus, and SARS-CoV-2, which is obviously now a human coronavirus, is that they are using the same drug that demonstrated efficacy in treating FIP in cats now as an experimental treatment in humans. So remdesivir is the name that people know it as. It has a GS 44152, I think is the experimental number name of it. But it is something that Dr. Peterson out at UC Davis has trialed in cats on 2 occasions with FIP and has demonstrated a remarkable response to that drug. And so cats go into essentially what we're describing as remission at this point. We won't call it a cure, but their clinical signs are reversed. And it's not just their clinical signs, it's also their biomedical markers. So their blood work is reversed as well. And they essentially become clinically healthy cats. For how long, we don't know, but we know that several of those cats have gone on for years, now more than 18 months. So I think we're approaching 2 years for a lot of those cats. And so that drug has shown remarkable success in treating FIP. Important to realize that it was used in the first SARS outbreak in people years ago, and was trialed in Ebola in people a couple of years ago when we had the Ebola outbreak, and is now being trialed in humans with CoV-2. And because of that, this drug is not commonly available for cats. It has not been approved for use in the United States. There is a somewhat underground internet black market for the drug. People can order it on the internet from China. Production is completely uncontrolled. Efficacy, safety, all of those things, what's actually in it, none of that is standardized. So we don't recommend it from the veterinary community because it's not controlled in any way. But having said that, there are people who have done it to treat their cats and are reporting good responses, depending on probably how good the formulation was that they got. It's not cheap. But that drug that is kind of on the black market out there on the internet from China is the same drug that is being trialed in New York City for humans.
Perfect. So, sorry. So, with going out in the field, working with the animals, or even within the shelter, what kind of PPE should they be using? What type of chemical should they be using to sanitize and make sure that that virus is staying under control or removed?
Great news on that is that pretty much any disinfectant kills this virus. It is an envelope virus. It is subject to soap and water. That's why washing your hands and singing for 20 seconds will do it. Any of the common disinfectants that we use in animal care will do it. A lot of people really like accelerated hydrogen peroxide and are using that as a standard. Normal dilutions of that are great because it can be a one-step, but truthfully, all of the quaternary ammoniums, all of the older cleaners work just as well.
So, and then just using proper precautions, maybe thick rubber gloves, or just could they use regular latex, or how just following their normal cleaning for sanitation protocols?
Generally, from the veterinary angle, and I'll answer from the veterinary angle, we are encouraging people to minimize their glove use whenever possible. And so in veterinary hospitals and shelters, we're really emphasizing hand washing as being more effective, managed control, and also reducing PPE. But I know for animal control agents, that can be tricky because if you're out in the field, you don't have a sink and soap and water. So I would imagine that you guys are usually talking about using disinfectants that you can carry with you and or hand sanitizer. Does that fit with what you guys are doing in the field most of the time?
Yes, if we can't get to one, and then if we're out, then removing the gloves, after contact, and then putting on a new pair of gloves. So this way, you don't spread the virus if it's on your gloves.
Yeah, I think it's really challenging because sometimes people don't know how to remove gloves safely.
Exactly.
There's full videos on how to put on gloves and take off gloves and all those things. And so even when we're coaching people on glove use, we often talk about washing your hands after you remove your gloves or hand sanitizing after you remove your gloves. I don't think you can ever go wrong with sanitizing your hands in this scenario anymore with this particular agent.
Right, and definitely recommending if you have never worn gloves before, you haven't been out there in the field, definitely watch one of those videos. It's very helpful. So this way you're not getting it all over your hands, and you can reduce that risk for yourself as well.
Excellent. Testing itself, the other thing I forgot to mention in testing animals, which again is not recommended, but if anybody is going to test an animal, they actually are required to have permission of the state veterinarian and the public health veterinarian in order to even consider testing. So that's another important thing to recognize, that that's a highly controlled test, unlike a lot of our other tests that we do.
So I got a question in here. It says, should animal shelters consider changing their cleaning and sanitation SOPs to include the more stringent cleaning protocols?
It's hard to answer, should they change, because it all depends on what their baseline cleaning protocol is, right? But I would argue that if they've got a good standard protocol to start with common disinfectants, making sure you use appropriate contact time. So it's not just about what you use, it's about the dilution at which you use it and the time that it sits on the surface. If you have all of those protocols already, this virus is not particularly hardy. And so in the environment, any of those cleaners or products or protocols should work. I think it's important to recognize that what is unusual about this virus is not how hardy it is how easily it spreads from person to person. So a lot of people have asked me, how is this any different than the last SARS outbreak? The last SARS outbreak wasn't this big, And the difference is that the last SARS was not as transmissible as this virus. This virus, a single person infects a much greater number of people. And so that is why this is different. The other thing is exactly what Lee referred to, that there's a large subset, we think up to 50% of people infected with the virus who are asymptomatic. And so they show no signs of being sick. And that was not as high in the first SARS. And so that degree of people walking around who look perfectly fine, but who then are infecting other people, that is significant in this role. And I think that also harkens back to our very first question, like, we're over the peak, when can we start again? It's really important to recognize that there's a large number of people walking around who are infected and not showing us that they're infected. And so part of the delay in getting things going is to give time for that to pass, so those people, become uninfected, basically, and stop and kind of make their way through without exposing a high number of people in the community.
EB, I'd like to kind of shift gears just a second, and from a shelter perspective, I'm curious if you're hearing anything with any of the folks that you're dealing with. You know, we're going through some economic difficulty here, and I'm sure the revenue stream for shelters has dwindled just as well as it has for just about everybody else. Mm. Are you hearing that the shelters are struggling to get basic supplies, food and things like that, or do you have any ideas or suggestions, if that's the case, how they can try to work with their communities to get more donations coming in?
Yeah, that's a great question. So I'm absolutely hearing that. It's one of the most common concerns people have across the country on some of the bigger calls I'm on. And it's somewhat regional. It depends on the size of the organization and the community that they're in. But everybody's struggling with some element of the financial picture that we have currently. Whether that is that they have to furlough employees because they need to cut costs and their labor is down, whether they're requiring everyone to take a pay cut across the board, and then essentially being able to pay for supplies and get access to food. There are actually some places, Puerto Rico being one, which, as you know, is part of the United States. They are actually really struggling to get food for the animals in their shelters at this point. Food all comes in through a central delivery, and they're having trouble getting deliveries. I know there are some other rural communities that are struggling equally to get food for animals. And so some of the ways is, again, appealing to the community. If there's any sort of community foundation or even individual donors who can help access food supplies or donations for the shelter and for food banks. We've seen a huge push to move pet food into food banks if it wasn't already there. And get it distributed. I know some of the larger national organizations like Greater Good are working to ship food to where it's needed and get some pallets out to some more rural areas. And so Greater Good has been a source for some communities to try and get some food for pets when necessary. I don't know that anybody has the perfect answer for this because, as you know, unemployment is rising quickly in communities. I've talked to people where it's as high as 15% in their community, and we're expecting it to hit 20 by the end of the month. And so that is going to have significant impact on the ability of pet owners to access basic supplies and medical care for their animals. And so another part of our strategy moving forward is not only making sure animals are fed and people are fed, but also figuring out how we prioritize the needs of those populations in the community in order to prevent those animals from ending up at the shelter. So I think a big role in shelters is going to shift to supporting animals in the community, both as a way of not overcrowding our shelters, but also as a way of maintaining that human-animal bond that's so important for people when they're going through hardships like this.
So we got another question in, Evie. It says, should animal shelters change their volunteer programs and more specifically foster programs to reduce exposure?
Oh, two big areas. Let me take the volunteer one first because that's a little easier. Some shelters really rely on their volunteers as unpaid staff. I think the word volunteer should be tossed out in a lot of shelters, and let's just call them unpaid staff because that's what they are, right? We all know who those volunteers are. They come in every day. They do a job that we rely on them to do. And so in some cases, they're structuring their volunteer program just like they're structuring their staff into A and B teams, or teams that are separated, as well as an at-home team. So if you've got volunteers that are in a higher risk population, then give them a remote job to do, which can be trying to organize a food drive and getting food delivered, or taking communications from people in the community that need help, that sort of thing. So for volunteers, we're treating them like staff and figuring out how to minimize their risk and exposure and use them in different teams in different ways. And I do want to point out that volunteers are often in a higher risk demographic. So another thing that I've been following is kind of how age impacts risk factors in this disease. And it's like 80% or more of cases are in people 50 and older. And that's substantial. Like, this is a disease, while young, healthy people can get it, if you are an older person, the risk is much higher. And those tend to be our volunteers in animal shelters, right? They're in a high risk category. So we also need to help them really take care of themselves, risk assess, and stay home if they shouldn't be coming to our building. They can become part of our remote team. Foster care. Foster care, we are turning foster care on its head. Our shelters have essentially evacuated into foster care in most of our communities. I've talked to shelters that normally have 500 to 700 dogs in their facility who now have 13. Their dogs are all out in the community in foster care and adoption. Same thing for cats, just flipped on its head, and they are all out there in foster care. And so now the work is in managing that. And so having a team of people who are working remotely, but available through Zoom, through phone, through however you want to set it up, managing all those animals in foster and supporting those foster parents. And then I added to that is a lot of medical for those foster parents can be done through telemedicine, which I already talked about a little bit. As long as those animals belong to the shelter, the veterinarian who works with that population can be providing some advice and help over telemedicine for that group. And I don't remember if I talked about it last time, Jess, but there's actually Best Friends has a telehealth program for foster programs in shelters that is free. And so the shelter signs up for it, and then foster parents from that shelter can access a veterinarian 24/7 to ask them questions about their foster pet who's struggling.
That's fantastic.
Yeah, and so that's a Best Friends foster app. If you Google it, you will find it. And your shelter signs up for it, and then your foster parents can call a vet at 3 a.m. when that kitten looks funny, and that vet will be available to them.
Wonderful news. And
Yeah.
I'm sure that'll help a lot of organizations out as they're still trying to get some help in regards to that. I do see a lot of success stories, though, with a lot of the shelters showing pictures of empty kennels and showing that they've been whether they've been adopted or they're all fostered out, so they don't have to worry about, staff coming in and maintaining that social distancing, and they can just go on to a regular routine and be able to work from home. And then, as animals come in, they can take care of them.
And I'm also hearing about a lot of foster fails. So one of the criticisms of this kind of flipped view of shelters is, well, what happens when this is all over and everybody brings back their foster animal and just runs it back to work? And one, it's not going to happen like that. We're all running back to work overnight, as we talked about in the beginning. But two, a lot of these foster parents are failing foster. And I mean that with the most respect, but a lot of them, when they are pushed to say, okay, we're going to now do virtual adoptions with your kitten and get it into a new home, the foster parent's like, oh no, you're not. I'm keeping this one. And so I do anticipate there will be quite a few foster fails in this situation, and those will become adopted pets in those homes.
But that's very encouraging.
I know, right? I love that. I have a few foster fails myself, so that's by no means a criticism.
I have not become a foster. I have considered it, but I'm afraid I'm going to have a house full of animals if I do that. So get attached very quickly.
Yeah, absolutely.
That's definitely how it works. Our last two were fosters, and they never left. So one more, I have a question, EB. We touched on it just now talking about when this is all over. Do you have any thoughts or ideas or recommendations for shelters as far as things to start to prepare to spin back up and so that you know, like as you said, hopefully it's not a case where everybody shows up the same day with their fosters. But do you have any strategies or suggestions on how to get things rolling again?
Yeah, I think we're going to have to phase it. I think, and I've been thinking about this a bit. I don't have an absolute answer on it yet, but it's my work for probably the next week is really kind of thinking about this. We're going to have to phase in things. And I think in phase one, we are still really emphasizing adoptions and foster. That is still, we've got to maintain those outcomes. I will say in a couple of communities I've talked to, they've closed those outcomes and they said adoptions and foster aren't essential. And I would argue that they're absolutely essential. They're probably our top priority is still that humane outcome pathway. So I think we still have to keep pushing on that, getting animals into foster, minimizing their time in the shelter. We're still going to have pets of COVID exposed owners and sick owners coming into the shelter for care. That has ramped up in the last week in the shelters I've been talking to. And so we've got some guidelines out there now for shelters in terms of how to care for the animals when they come into the shelter. And protect your staff, which again, they're very low risk, but we're being super careful about that. And so we can't lose sight that we're still going to have animals coming in needing some care. And we've got to reserve some of our energy and time and kennels for that activity. And then I think we start to look at who, like I said in the beginning, are top priority patients. So are there some animals that really need some services for their welfare? Are there particular groups of animals that we need to kind of get put in line first for spay-neuter services? Probably. So let's figure out what that looks like. And let's figure out how to do that in the safest possible way for our people. But I don't think we should rush it because we're going to pay the price if we rush it. And so we're not there yet. But I think it's worth starting to think about the phases of what this looks like. And then who in your organization is part of each phase, and start bringing them in that way. I think keeping the team approach is still important. In the event of an exposure, you don't want your whole organization to shut down. I think it's going to be important for a few more months. And I will tell you from a university standpoint, the university is really thinking of this. At this point, we have everything closed until the middle of July in terms of travel. Or changing anything about what we're doing currently, regardless of what may come down from the state. And that's because we're such a large high-risk population at the college. And so just to kind of put that in perspective, we're not there yet. But I think it's fair to start thinking about it in phases.
Thank you. We got a couple questions that came in. Just want to hit them really quick. I know we're getting short on time, but this is about spay and neutering to avoid euthanasia. Through cat colony caretakers and rescues in our area are aware of the hold on spay and neuters. Property owners who view cats as a nuisance are still trapping and bringing the cats into our shelter. Our shelter cannot house feral cats long term. Nope. So would either have to euthanize these cats or after their stray hold or spay and neuter them for release.
And so you're not going to like my answer, but what we are saying is that they should not be euthanized and they should not be held for spay neuter. They should be put back where they came from, and property owners should be told that you will not take feral cats at this time, precisely because you don't have an outcome for them. You can't house them long term. And you don't want to kill them because that is not your job. And so the recommendation is that before these property owners walk through your door, that they get the message loud and clear that you cannot take these cats right now. You just cannot take them. And potentially, Emily, I would say that you could look at whether, I don't know if you have a veterinarian working with your organization, you could look at the birth control aspect I talked about in the beginning. If there's a veterinarian you can access who would be willing to order from a compounding pharmacy megestrol acetate, which is the name of the substance, it's compounded, those cat colony caretakers can stick it in. They can have birth control casserole every Wednesday or every Sunday. It's one day a week. And I know that there are groups that have kind of doled it out, on tiny plates around the place, and you can't assume that every cat's going to get it. You don't want to give it to kittens. It's for adult cats. But there is an element of trying to use that to reduce pregnancy in that colony. But the absolute answer to that is colony caretakers should not be trapping. In the list of essential services and recommendations from various agencies, including the National Animal Control Association, all of the shelter medicine programs, and the large national humane organization groups, trapping needs to stop because we don't have a humane outcome for those cats. And truthfully, a lot of those cats are doing just fine where they are. We would like them to be spayed and neutered. Nobody wants them to be spayed and neutered more than me, but we can't do that right now. And otherwise, we don't have a humane outcome for them. So they need to stay. And I will tell you, a lot of animal control agents are just taking those traps right back to where they came from and opening the door and letting those intact cats out. That's the recommendation. I know that's hard to do. I am glad it's not my job. I haven't had to take a trap out and open it and let an intact cat back out. But that is the recommendation. And my second option would be get some birth control for those cats. And maybe that'll make the property owners happier.
Another question, are there walking services available for people in quarantine with an active dog? Do you know of any, or is there a possibility of that still being open? I know that a lot of parks are closed at this time, so.
Yeah, that depends on where you are. I don't know of any walking services for dogs for a quarantined owner. And I think that's more of a concern in urban communities than potentially in rural. Like if I was quarantined on my acreage out here, I would just walk my dog around my yard. But I do know in cities that's a problem. There are not services. Generally, the recommendation is that this is a place where you start to rely on your friends and family, which I know is not there in every community. But even for people who don't necessarily have family in the area, I know of groups of people in cities that essentially have created a pact to help each other with their animals in the event that they are exposed and or sick. And so you create a caretaking group amongst your group of friends and or family members to provide those services if you are unable to do them for your pet. And we've been pushing that pretty hard in the last couple of weeks, and it does seem to be kind of getting out there in terms of messaging, that this is really, again, about figuring out a plan for a family member, and that includes your dog that needs to be walked, etc. If you can't do it, trying to figure out somebody else who can. I don't know of any services. Although I imagine there's probably some people marketing them. I live in the country, so it's not something I've had to access myself.
I just want to come back to the donations part, and we talked about this a little bit, but are there any precautions that should be taken when donated food or items come in at this time?
So the only guidance we have around that really is those initial studies on how long this virus lives on surfaces. And it can live up to 72 hours on plastic and cardboard. And so similar, people go to different extents, but if stuff's getting dropped off and you're concerned at all, you can wipe things down. Most of the donations that we get, if it's food bags, you can wipe them down with basic disinfectant. I wouldn't soak them, but a cloth and wipe them down. You can let things sit for a couple of days if that makes you feel better, which is what some people do with packages that get delivered to their homes. And if it's anything that's donated that can be put in the laundry, you wash it. Because basic laundry cycles and dryer cycles will kill this stuff. So nothing to worry about if you can just dump it in the laundry. That's my answer for that.
That's great.
Beautiful. And thank you for that answer. And thank you for your time again today, Dr. Berliner. We certainly appreciate all your wisdom and knowledge that we've been able to share with our folks here today. Any last comments before we get out of here today?
No, I think probably the only other thing I'd go back to is, again, reminding the people in your community to have a plan in the event that they get ill. For our more rural communities, we're still going to see these cases spreading. And so I think it's really important that people do have a plan for their pet, have prepared essentially 2 weeks worth of supplies, a carrier for cats, a leash for dogs, that sort of thing, just so that if the worst thing happens and you get sick and you need to go to the hospital for care, taking care of your pet is not a roadblock to that. I have heard stories of people refusing to go to the hospital because they were worried about their cat or dog. We don't want to see that happen. We want to make sure that people can access care and that their pets are not something that they have to worry about. So your first line is to kind of come up with a plan for yourself. And if that doesn't work out, your shelters will be there for you. That's why we're still operating at essential and emergency functions, right? So we'll be there.
great advice and great information. And again, thanks for joining us. Your expertise has been awesome. We appreciate the help, and so do the guests that have joined us here. So if you've got any questions, folks, give us a call at that 800 number, 1-800-822-3747, extension 176. And we'll be glad to help you with any of the questions that we might not have gotten through today's program. So be safe out there. Thanks for joining us, and we'll see you next time.
Thanks, guys.
Thank you,
Thank
Evie.
you.